I want to start with this quote. I've shown this quote in other videos as well, but this is from 1927, in which the author writes, "The secret of the care of the patient is caring for the patient." But then in 1995, somebody modified the quote a little bit. And I think it's very important to understand the message that the new quote and the modification is trying to make. So in 1995, this author, she changed the quote and said, "The secret of the care of the patient is caring for oneself while caring for the patient." So I think this is a very important aspect that we have to talk about. This is related to self-care. So back in 1995, she focused on the fact that we have to care for ourselves as healthcare providers, as physicians, as people who take care of our patients, that if we want to be effective in caring for our patients, we have to take care of ourselves first. And that is the importance of self-care. So this was a quote from 1995, and here we are about 25 years later, still trying to talk about and understand self-care and the importance of self-care. So let's talk a little bit about different aspects of self-care. So first of all, we have to recognize that self-care is not a sign of weakness, but a sign of personal strength, commitment, and success. So unfortunately, the culture of medicine is one that you just kind of have to power your way through the day and muscle your way through medical school and residency and training and your day-to-day tasks. And that culture where we're just pushing ourselves and not taking care of ourselves can really have a detrimental effect on us, and can lead to depression and increased rates of burnout. So we have to be very, very aware of that. And again, we shouldn't ever feel like, I'm the only one that's struggling with this issue, and I'm the only one with this problem. We have to openly talk about it. And self-care is such an important aspect of providing good care for our patients, but also taking care of ourselves so we can provide effective care for our patients. So again, self-care is not a sign of weakness, it's a sign of strength. We have to make sure we are taking care of ourselves if we're going to take care of our patients. Okay, so there's different relaxation techniques I want to talk about. So this one I want to focus on what to do before you start anything that is going to be stressful or challenging, right? So you have to do something and you're anticipating that it's going to be a challenge and it's going to be a stressful encounter, let's say with a patient, right? So what are some things that you can do to help you prepare for that and help you relax before you have that encounter? So there's some things that you can think about doing. So some suggestions can be that you prepare for what might occur during the encounter, and maybe you kind of develop a script of how you may respond. So you think about what you're going to say in advance, and then you kind of anticipate what the response of the other person might be, and how are you going to respond to what they are saying then, and kind of go through that in your mind and almost make a script and practice it, and just kind of think about what you're going to say in advance and prepare for that encounter, and then anticipate what they might say, and then what your response might be in that situation. Other things you can do before going into a stressful and challenging situation is kind of take a pause and kind of ground yourself and center yourself before you begin. Just kind of go, before you begin, just kind of pause, think about what's about to happen. Maybe take a deep breath before you start. Maybe you do a little brief few second meditation, or you say a brief prayer, and then you think about something positive, that you're ready for this, you got this, it's going to be okay, and you just kind of ground yourself and center yourself before you go into a challenging or stressful situation. So I kind of use some of these strategies in some of my own patient encounters. So for example, in pediatrics, we will deal with kids that come in with some sort of injury. And sometimes it's hard to know if that injury was accidental or if that injury might have been non-accidental, and some sort of non-accidental trauma or abuse or some intentional, type of trauma that was inflicted on the child. And when we're not sure, then we might get child and protection services involved to help investigate the situation, to help us determine whether this is an accidental injury or a non-accidental injury. And these type of interactions with families can be very, very stressful when you have reported them to Child Protection Services for an investigation. So I know when I have to go in and talk about that to a family, I use some of these techniques. I anticipate it's going to be stressful, and then I think about what I'm going to say, how I'm going to start the conversation, what I'm going to say, and then I kind of think about what the response might be and how I might be responding to what they are saying back to me. So kind of going through a script in my mind of what might happen in that interaction. Now, sometimes it doesn't go that way, which is okay, but it can really reduce anxiety when you kind of think about what you're going to say and you kind of prepare in advance. And then before I go in, I definitely take a pause. I kind of ground myself. I center myself. Kind of take a deep breath. Tell myself it's going to be okay. Maybe even say a little prayer of, oh, I hope it's gonna go well. And you do what you can before to anticipate that stressful encounter and kind of prepare for that, and then you go in and start the interaction. So I found this very helpful when I'm about to have this type of interaction with this type of a patient or family then. So okay, so how about some relaxation techniques you might use during this stressful encounter and emotionally charged discussion that you might be having. In that scenario that I gave, a lot of times when you go in, the family's very upset that you reported them to Child Protection Services, and you're basically accusing them of inflicting the injury, right? And they kind of say to you that you basically are accusing me of hurting my child, right? So it's a very stressful encounter. They might be threatening to call their lawyer, so it's going to be stressful. And during that encounter, you can see that they are very upset and kind of blaming you for, accusing them of what they might have done to their child, and such. So some techniques that can be helpful during that encounter are really, in my mind, based on emotional intelligence skills. So emotional intelligence is really being able to understand and recognize your emotions, and being aware of how you are feeling. So you have to remain mindful and present, engaged, and composed during that interaction. And that requires a lot of self-management and self-control, which is again is an emotional intelligence skill. So really recognizing your emotions and how you're feeling in that situation, but then staying composed, and having self-control, and then recognizing your reaction to that situation. That's all part of emotional intelligence that can be very important when you are going through a very stressful encounter. And again, you should always maintain control. You should always stay composed. You should always recognize that you might be getting upset or frustrated, but make sure that you recognize that reaction and then react in a way that doesn't exacerbate the situation, or make it worse in any way. So always be in control of your emotions and what you are saying, and how you are interacting with that family during that type of discussion. And sometimes you may need to find a way to step away from the situation to kind of compose yourself, right? Because they're yelling at you, or they're upset, or whatever they might be, and you might have to say, you know what, I'm just going to step out for a moment, and then when you calm down, I'll be back, and we can continue the discussion. Or you just say, okay, you know what, I just need to step away, and I'll be right back, and you excuse yourself and find a way to excuse yourself so you can kind of regain composure, and then go back in and continue the conversation if that is needed. So these emotional intelligence techniques, I think, are very helpful during these type of stressful situations, and I try to use these when I'm having my discussions with these families where Child Protective Services might be involved, and there might be a very difficult encounter with the family. So how about after you have a very difficult encounter and stressful encounter, a challenging encounter? How do you try to relax afterwards then, right? So sometimes things that can help is after you have this encounter, you first of all, you have to recognize that that was very stressful, right? And that you went through a very difficult and challenging situation. So you step out and you're done with it, and you just kind of take a deep breath and relax that you got through it. It went okay. You might need to, go to the bathroom and kind of splash some water on your face just to kind of relax a little bit. You might need to go to a quiet room just to kind of decompress a little bit, and just kind of regain your composure. You might want to take a walk outside and get some fresh air, or go to a window and look outside and look at the sunlight. But you need to make sure that you really decompress and that you gather your thoughts and you regain composure. So sometimes these stressful situations can really take a lot out of you, and can really drain you and really suck the energy out of you. So you need to recognize that, and then you need to be able to regain composure and decompress afterwards. And you might use other relaxation techniques as well when you have time, either immediately afterwards or later in the day when you go home, where you might do other techniques of some yoga or some meditation, or listening to music, or using nature to help you relax, or exercising, or whatever it might be that is effective for you. That it's going to be important for you to take advantage of those type of relaxation techniques after a stressful day, after a stressful situation, after a stressful encounter. You might want to talk to a friend. You might want to talk to a colleague. You might want to kind of debrief about a situation that might have happened. And you might want to just again talk to a family member or a friend or a colleague and say, you know what, I don't want to talk about the situation, but let's just talk about something else. So that can help you get distracted, and you can talk about something else, and they can make you laugh, and they can make you feel better about things, and that can really help you kind of relax from that type of stressful situation. So I think it's very important to keep these type of techniques in mind when you go through a stressful situation and stressful encounter with a patient or anything else that you might be encountering then.